Welcome, everyone. We're so glad you could join us this afternoon, and we are so excited to talk about pandemic EBT and the lessons learned that happened with the implementation last spring so that it can help inform the next phase, or as we affectionately call it, P-EBT 2.0. Today, I'm joined by Etienne Melcher-Philbin from PRAC, Zoe Newberger, my colleague from the Center on Budget and Policy Priorities, and Alicia Kone with Kone Consultants. Next slide. And before we get started digging into the meat of the webinar, I just want to kind of level set about pandemic EBT. I'm sure most people on the webinar today are familiar with it, but just to kind of get us all on the same footing, it was created last March through the Families First Coronavirus Response Act. And so it's a pretty new program, although it did operate very similar to how summer EBT would operate, in that it provides an EBT card to purchase food at retailers, and it follows under SNAP. It's designed to provide nutrition resources to families to replace school meals, the school meals that families lost when schools closed last spring in response to the pandemic. And it is an optional program, but I'm excited to report that all 50 states, the District of Columbia, and the Virgin Islands all created and implemented a P-EBT program for the 2019-2020 school year and got benefits out to families who desperately needed them. Some states also amended their plans to provide additional benefits to children who missed meals this school year because it was set to expire on September 30th. So some states were able to provide benefits for August and September if there were school delays, school closures, or if children were learning virtually. Next slide. And I'm also very excited to report that P-EBT has been extended. In September, Congress extended it through September 30th, 2021. So that means that states will again be able to provide benefits to families who need access to them. It also made a number of improvements to P-EBT to make it operate and function better this year. So it allows states to provide benefits to children who may have a reduction in the number of days or hours that they are physically in school or in childcare. And so that means that it can be more responsive to the different ways that schools are going to be operating and are operating this school year. It also allows states to use simplifying assumptions in order to make it easier to determine benefit levels, eligibility, and eligibility periods for kids, so that we think it's going to really help states as they think through how to run the program this year. It allows states to provide benefits to those young children who are in childcare and receive SNAP. So we're really excited about that expansion to help support our younger kids. And it also brought Puerto Rico and the other territories in to implement P-EBT because they had been left out back in the spring. And the other thing that I think people are really excited about is that it provides funding to fully cover the state's administrative costs. With the first go-around, states could claim 50% of their administrative costs following kind of the SNAP rules. But this time around, states will be able to claim all of their administrative costs. We are currently waiting on USDA to issue guidance on the extension and expansion of P-EBT, so we will not be digging into kind of how that's going to look. Instead, we'll be looking to the past so that we can help guide our future. Next slide. And the next phase of P-EBT, I think we all realize is going to be very different. You know, in the spring, all the schools closed. Or virtually all the schools closed. And this year, there are so many different ways that schools are operating this year. You know, they're reducing hours, they're having kids come in for a couple days a week. In some school districts, some schools are open and other schools are not. Maybe the elementary schools are open, but the middle and high schools are not. So there's a lot of questions and challenges, which I think fall back to the importance of the simplifying assumptions that I mentioned earlier. One other thing that states may not have to contend with as much is getting P-EBT cards out to millions of children. Many more kids have those P-EBT cards already, so that may help ease the process. One of the challenges we're seeing is that a lot of schools either are not collecting school meal applications because of the child nutrition waivers that are allowing schools to offer free meals to all students, or they did try to collect school meal applications but had a difficult time collecting them. So that is one of the big questions that we're thinking about as well. And as I mentioned, there's the 100% match for administrative costs. So we think that that creates an opportunity for states to really kind of think through, you know, what they would want to do differently and whether or not additional administrative funding would help to make that a reality. Next slide. So the focus of the webinar is really to kind of dig into our rapid assessment project. And FRAC and the Center on Budget, we conducted a rapid assessment project to document the development and implementation of P-EBT benefits for the spring. The project identified the various approaches that states took to implement pandemic EBT, as well as key preliminary lessons learned, primarily through an online survey and interviews with state officials and other stakeholders. We were thrilled to work with Kone Consulting and Rachel Cahill Consulting on the project. Alicia Kone is on the call, as I mentioned earlier, but I want to also give a special shout out for Rachel Cahill, who was an important part of the project as well. And so we have developed a number of products, including the two pieces that we're planning on talking through today. The first is the full P-EBT implementation documentation project report. The name just rolls off the tongue. And the second document is the lessons learned from early implementation of pandemic EBT, opportunities to strengthen rollout for school year 2020-2021. And as you can see, we really, really like long names for reports. In addition to those, we have state-specific profile tables with the key aspects of how each state P-EBT implementation took, and a resource library, which is actually a searchable database with P-EBT implementation resources from last spring that were developed by state agencies and other stakeholders, which we gathered between April and September 2020. And we're doing in-depth state case studies. Alabama, Texas, and Wisconsin are already online, and we plan to soon, we are planning to release soon Arizona, Kansas, Minnesota, New York, and Pennsylvania. So stay tuned for that. And also coming soon is a spreadsheet with underlying information collected on key aspects of each state's implementation. And now I'm going to hand it over to Alicia, who's really going to kind of dig into the meat of the report.
Thank you so much, Crystal. I want to start first by spending a moment on gratitude myself, because my name is Alicia Kone, and I'm the owner and president of Kone Consulting, also a former SNAP director from the state of Washington. So that's my programmatic background. We were so honored to work with the Center on Budget and FRAC, and especially Rachel Cahill on the study. But I also want to pay a special thanks to all of the state staff and school district staff and advocates who took time during a time when they were already very busy trying to get this program implemented to fill out our surveys and speak with us in interviews and review data as a follow-up. So very, very much appreciate that. And it is my honor to present to you just sort of a tip of the iceberg of what you'll find in the information that Crystal just plugged on the website. So I hope you did or have already taken the time to poke through that a little. As Crystal said, 52 states and territories were able to stand this program up for the very first time in a very short amount of time. And the first research question we were interested in was, how did they actually deliver benefits to children and families? We started our hypothesis thinking there might be one, maybe 2 or 3 different categories. One of them we thought of as are called automatic issuance, or later start to refer to as direct issuance. And that means that benefits were able to be loaded onto an existing SNAP card. So that was one way that benefits got directly issued. Or a new card, a new EBT card was issued just for P-EBT, but there wasn't additional information needed from the family, so that card was just able to be sent to the family with directly. The other way was for states to use applications. And you can see some of the breakdown of the details of how those categories fell out. So I'd say there's sort of this middle group that used some hybrid approach, and of that middle group, about 30 states were able to directly issue benefits to families who were receiving some other benefit program besides SNAP, and then 31 states were actually able to directly issue to, benefits to children who weren't getting SNAP or any other benefit. In other words, they got a new P-EBT card, but their families didn't need to apply. I think we can advance to the next slide. So we conceptually, when we were doing the initial analysis of the information that was coming in from states, we're really struggling to fit issuance models into just 2 or 3 buckets, because we realized that the real world, as always, is more nuanced and interesting than that. And so what ended up kind of developing for us is this idea of a spectrum. And on one end of the spectrum were states that only used applications, and examples of that in this round were Louisiana and Wyoming. On the other end of the spectrum were 27 states that only used direct issuance. So they worked as hard as they could to find data on those kids and sent them benefits either on an existing EBT card or on a new P-EBT card in the mail. And then there were this group of hybrid states in between that did some combination of direct issuance to certain groups and applications for other groups. And what kind of became apparent to us is the intent of those applications was important. To understanding the state's intent was important to understanding where to place them on the spectrum. So for example, the states that are in that kind of darkest gray area, the 4 states that direct issued that had a backup application, it was just that. They tried to directly issue to everyone, but they wanted to have a safeguard for families who may have fell through the cracks, if that makes sense. You can definitely, this is an area of study that needs more research as the outcome data becomes more available, because we were literally studying this program while some states were still implementing. We had very limited access to outcome data. So it will be very interesting when outcome data is more available to compare some of the models that states used and their efficacy in reaching children. Next slide. We were really interested in understanding in the moment, while it was still fresh in people's minds, well, what were the drivers of your decision-making process when you were designing your issuance model? And I think some states would sort of laugh or roll their eyes even hearing me say designing their issuance model, because remember, these were emergency meetings that were happening largely after states and schools had closed or were on stay-at-home orders. And so it was already feeling chaotic. But the 3 things states told us mattered most as they were making decisions about their model were, first of all, the availability of student information. It turns out it's not as easy to get a list of all the kids eligible for free and reduced price lunch as you would think. The other big decision-making factor was the systems and technology capacity that they were working with, and whether or not they felt they could spend any money or would need to spend money to upgrade those systems to support the program. And then finally, we heard a lot, this was all happening in a backdrop of feeling a real sense of urgency to get benefits out to families as quickly as possible so kids didn't go hungry. I think, that in itself just sort of describes this decision-making environment that was happening. Next slide, please. So as I mentioned, the main task for the Child Nutrition Agency and the SNAP agency and the school districts or ELAs in the state to take on was to put together what we called and what states called a master list. So this was the list that would verify eligibility, free and reduced price lunch eligibility for kids. It was going to either be used to directly issue benefits by somehow getting it to the EBT vendor, and we'll talk in a minute on some of the decisions states made about that, or that master list was needed even in application states because that list was used to confirm eligibility once the applications came in. So either way, all states had to figure out how to build a master list. And in some states, that was more of a Herculean effort than in others. So, once that list was built, the purpose of it was to tell the EBT vendor who needed to get benefits on their card and who needed cards. It's interesting to look at some details on the ways that states did that. I said, Crystal talked earlier about the 50% admin match in this last round, and that did limit what states could do in terms of changes to their IT systems. Only 10 states were able to create a new P-EBT benefit code in their eligibility system that supports P-EBT. So that master list went through the eligibility system, had its own unique code, and that list went to the vendor. And I apologize for IT people if I just butchered that. But that's basically what happened. There were 16 states that couldn't even figure out how to get it through their eligibility system and just had to bypass that altogether and work with their EBT vendor to be able to accept those master lists directly or somehow to work around that. Next slide, please. So the other thing we learned that states began to figure out very quickly was, well, if our goal is to get benefits to kids as quickly as possible, there are some kids that are going to be easier to reach than others. And independently, yet really interestingly, almost uniformly, states started to talk about phases. And almost uniformly, they determined the first phase of issuance should be to kids whose families already have EBT cards because they're on SNAP. And then they worked on the kids who they could identify because they were on another assistance program, so they knew how to get them, they had a good mailing address for them, and they could send them out a new P-EBT card that had a lot of information about that family. And then the third phase starts to look a little different depending on the state that you talk to, but it oftentimes includes anyone who could be newly eligible for free and reduced price meals. So there were states that tried to catch those folks because, of course, there were families whose parents and guardians were losing jobs and having changes in income and becoming newly eligible for free and reduced price lunch while this was all being implemented. And then the fourth phase was usually for those cases that were hard and would need some kind of troubleshooting or problem resolution. Sometimes states referred to that as their cleanup phase, where they're just trying to catch the last few kids they could. Okay, next slide. So on that topic of newly eligible children, 34 states in the survey data and then in some of the follow-up interviews we did for in-depth interviews or in-depth case studies confirmed that they did extend P-EBT benefits to newly eligible kids. But what we learned is there was quite a bit of variation on how they did that. There were states that did that through an application process. There were states that tried to do that through some kind of cleanup file or combination of the two. But what we now understand is in any of those cases, there really was a two-step process, because if the family were newly eligible, first they would have to somehow get on the FERP list. They would have to be determined eligible for free and reduced price lunch. And then they went through a second step, which in some states was another application in order to connect to the P-EBT benefits. And because of that, and just the short amount of time that states had to implement, the concern is that there may have been a number of families that got missed, and this is certainly another area that further research needs to be done in. Next slide. There's a lot of decisions states had to make, including who to issue the cards to. So I'm going to start not at the top of this chart, but in the middle, where we identify that there were 13 states that issued cards to students, or at least either to each individual child in the household or to the oldest child if they could determine if children lived together. So I'm going to pause for a minute for those of you who were in states that issued to heads of household only and for whom that's kind of a revolutionary thought. There were also 12 states that were issued cards to either the head of household or the student if they couldn't find the head of household. So about 25 states have some experience with issuing cards to students. And again, from, as a former SNAP director, the idea of sending benefits in the name of kids is pretty jarring, maybe even, but there's some interesting things we learned about that, which we'll get to here. A couple of them we'll get to in another slide, but one in particular I wanted to call out here is by issuing cards to children, those states to a certain extent avoided the problems with missing data that the states had who issued to parents, because it's harder to figure out who the parent or guardian is of that child through the child nutrition data. So in that case, if you issue to children, you avoid that problem. It also affected decisions about who cards got issued to. Go ahead. Yes, please do. You got my transition just perfectly, Nomi. The decision about who to issue cards to also affected decisions about card activation. So card activation, it just means the pinning process that anyone who gets a SNAP EBT card goes through in a state, or you might be familiar with if you've received a credit card or a debit card in the mail. It's the same idea. Depending on the EBT vendor and the wishes and design of the state, states made different decisions about how to handle that pinning. And you can see some of the data on that on the slide, and we get more into that a little bit more in the report. The interesting thing that states learned about the impact of card issuance on this process is particularly in the states that were issuing to either the head of household or the individual student if they couldn't find the head of household's information, ended up confusing families about pinning because there were so many different pinning options to choose from. So again, issuing cards, the states that issued cards only to children tended to have more straightforward pinning instructions and fewer questions about that. And in a minute, we're going to look at more information about family inquiries. But first, another thing we did through this study was gather up as much information as we could about the communication materials that states were using this first round. And that information, as Crystal mentioned, is all available through the CBPP website or through FRAC in the resource library, as we refer to it. So one example of the kinds of communications that we asked states about were the kinds of communications they used for, to public, what public information campaign messaging they put out. Most states were all required to conduct some kind of PR campaign. Nearly all states used sort of the standard press releases and obviously posting information on their own websites, the SNAP website and the Child Nutrition website. But the majority also embraced social media platforms. And one example is from Kansas that you're looking at here on the screen, which is a tweet that Kansas did announcing a town hall that they hosted to give more, make sure there was information out in the community. Another example, can advance the slide. Of course, there were communications that were happening through schools. Unfortunately, schools were largely closed, which is the reason this program was so important, but that also meant that they had less access to their standard communication channels with families. The example that you're looking at on screen here is an example of how Oregon schools partnered with a community-based organization that ended up doing robocalls to families about P-EBT, and this is the robocall script that they used. So there were creative solutions that were certainly being used by districts who are feeling strapped or like they had limited ability to communicate with their families. I want to just shout out to the state of Texas as a unique example of commitment to communication. Texas was the only state that we're aware of that required all of their school districts to directly communicate with families about the program multiple times, and each of those times it needed to include the link to the web portal that had been set up to take applications. If you're interested in more examples of things like that RoboScript, check out the resource library on the CDPP website. And then finally, of course, states were communicating directly with families too. Families that received P-EBT cards, new cards in the mail, typically got a letter along with that card explaining what it was for and how to use benefits. And then states also used things like flyers and their own website to communicate directly with families by setting up things like email inboxes that they could communicate with. So one lesson here that states mentioned to us was some states overlooked sending letters to the families who received benefits on their existing SNAP cards and ended up answering a lot of questions from confused families who wondered where their benefits were, only to learn that their benefits had already been deposited on their card. It just got very muddled with the supplemental SNAP benefits that were also being issued around the same time. Those states said next time they would definitely send a letter along to their SNAP families too. So why were families contacting the states if they had questions? Let's advance to the next slide and learn a little bit more about that. We weren't able to get good data on the volume of inquiries, partly because states were too busy responding to inquiries to really spend time with us to pull that information. That is another area we really look forward to folks doing further research on. But what we were able to ask in the survey was give us examples of the common reasons families are calling. And so you can see a ranked list there. The thing that I think jumps out at me is that the most common inquiries were related to questions about eligibility, which absolutely, questions about their own eligibility or confusion about some individual children's eligibility in the household, which tracks with my experience with other human services programs and why people inquire. It also is an area that I think could be potentially supported with tools like FAQs in the future if states had more time. So finally, as I mentioned, there were those phases, and a lot of times the last phase for the state was to try and get to the cases that were troublesome in some way in terms of trying to get to process. First, before we get there, states set up several different ways to receive inquiries from families. 48 states, considering how busy they were and how quickly things had to happen, 48, we think it's really impressive that 48 states were able to stand up either a new or existing call center. And even 8 states were able to do some programming on their online benefit portal to support P-EBT there. So I think there's some really interesting things to look at. Potentially other states can look at that for the next round. I think we, well, I think it's time for me to turn it over to Zoe. I was just going to finish that thought by saying we think this is another area that would be interesting for further inquiry. There's more information in the report, but to end the way I started, we are just so impressed with the dedication and the energy and the commitment that states put into implementing this program, and the energy and commitment they put into making sure every family got reached. So thank you, Zoe. I turn it over to you.
Thank you very much. So now we're going to shift gears from looking back on what states did to provide benefits for the spring to looking forward to the lessons that we learned that could improve the next round of implementation. And we'll cover the 6 areas listed on this slide, starting with the importance of directly issuing benefits. You'll notice as we go that we're not going to talk specifically about applying these lessons to children in child care. We'll likely address that in a future webinar when we know more about the guidance and how states are considering approaching implementation. Next slide. So our first recommendation is to directly issue benefits rather than relying on an application if at all possible. And just to explain what you're seeing here, this map illustrates some of the figures that Alicia shared earlier. It focuses only on children who were not receiving SNAP or other benefits. So in blue, you see the 31 states that were able to obtain data so that they could issue P-EBT benefits directly to children who were approved for free or reduced price meals. And typically they got that data from their state education department, school districts, school meal data systems, or individual schools. In yellow, you see the 25 states that relied on a P-EBT application to issue benefits. And there were 4 states, as Alicia mentioned, that used a combination of the two. Now, we don't yet have outcome data to know which approach reached a greater share of eligible children. We very much would like to know that. But we do know from other contexts that every time you require families to take an action, that reduces take-up. We also know that having to complete an application, even a simple one, was asking one more thing of families who are experiencing severe hardships and extremely difficult, under extremely difficult circumstances. And from the state perspective, while you can go back, I'm still on that first one. While gathering the information necessary for direct issuance was definitely not easy, it took quite a lot of work. We also heard in our interviews with state staff that applications seem to be, if anything, a heavier lift. Developing the new application, informing families about it, and responding to inquiries seemed to make benefit issuance slower and more complicated. And in fact, several states that had used applications over the summer have switched to directly issuing benefits, and we're hoping that most states that used an application will follow suit and switch to direct issuance going forward. Now we can go to the next one. So we have identified some steps that could strengthen direct issuance, and I'll walk through those now. First, some states charged one state agency with developing their P-EBT plan, whereas others brought the SNAP and Child Nutrition agencies together from the start. It definitely seemed like the earlier those agencies began working together, the more smoothly implementation went. And hopefully with those relationships more in place from the earlier implementation, that will be a more natural place to start. Next, we know that data matching can be improved with deliberate effort. For more than a decade, the school meals program has been required to use data matching to automatically enroll children in households receiving SNAP and sometimes other programs for free school meals. And over the last decade, states have made huge improvements to data matching in that context. So we know it can be done with concerted effort. But P-EBT required matching to be done very quickly, and it was in the other direction. And it seems like some of the improvements that states have hit upon in the direct certification context were not always employed here. And we're hoping that with a little more lead time, states can incorporate some of those improvements and miss fewer kids in the process. But even the best data matching misses some children. So it's best to avoid matches unless they're absolutely necessary. And one match in particular struck us as not necessary, which was matching children receiving SNAP benefits or who are other categorically eligible, like children receiving TANF benefits, to student lists. And that was done to weed out the very small numbers of children who attend a school that doesn't offer the federal meal program or who are homeschooled. The USDA did allow some states to skip this step if they could make a strong case for it, and we hope that they'll be more flexible going forward and that more states will ask to skip it. That said, given the more complicated situations, more complicated operational approaches that schools are taking, in places where meaningful numbers of children are attending school in person, that match might be necessary. Now, going back to who the card gets issued to, Alicia mentioned that about half the states issue cards to caretakers, and in general, implementations seem to go more quickly and smoothly when benefits were issued directly to children. Some states told us explicitly that if they could go back and do it again, they would issue benefits to children instead of adults. And in some states, this change alone would allow them to switch from an application to direct issuance because they were using the application to get the names of the head of household to issue benefits to. Now, another issue that almost all states contended with was that the address on file with the school was often several months old and outdated. And developing a mechanism from the outset for families to update their address would be very helpful. For example, the Philadelphia school system arranged for robocalls to families in which their mailing address on file was read aloud, and then they were given instructions about how to update it if necessary. So that was a great model. They did that before they relied on the addresses to mail cards. But even an address form that's available after benefits are issued is helpful because it reduces the number of inquiries and difficulty resolving them. And then finally, as Alicia mentioned, troubleshooting consumed a lot of staff time, even if it was only needed for a relatively small portion of families getting benefits. And so developing a clear process for families who are inadvertently missed in the direct issuance process, such as providing an online form, can help reduce the number of inquiries and make sure they aren't being worked on simultaneously by multiple people or agencies. Next slide. Despite our wishes, we recognize that some states may end up using applications, and so I want to take a moment to talk about how to make an application accessible if it is necessary. And many of these are not specific to P-EBT. First, keep it short and simple. It's very important to ask only for the information that's required. Our report includes a chart with every item that each application asks for, and many included items that were not necessary and even not required. And even if the application could be submitted without a response to a specific question, those items made it more burdensome and might have kept some families from completing it. We're especially worried about applications that ask for a Social Security number, because those could keep eligible families with immigrants from applying, even if they were eligible. In the context of regular school meal applications, schools are not permitted and school districts are not permitted to ask for Social Security numbers. And FNS said, therefore, that they could not be required on P-EBT applications, but even the presence of an optional question could have a chilling effect. A couple of other things that can make it more accessible are to make sure the application works on mobile devices and to make sure that there's a way to complete it without internet access, for example, over the phone. And as Alicia mentioned, many states were using call centers to troubleshoot. They could also use those call centers to take applications over the phone for families for whom that's easier. If they, somebody calls and they realize they're eligible but hadn't completed an application, instead of them directing them to an application, they could just complete it on the spot. States that tried to send the link only to eligible families generally ran into trouble because some eligible families didn't receive it, and then it ended up being widely shared, both by families with each other and ultimately by state agencies. And so we ended up concluding that making it public from the start would generally work better, and if states need some kind of behind-the-scenes mechanism to confirm eligibility, they could build that in, rather than trying to use limiting who got the link to serve that purpose. And then last, federal law requires that communications with families related to the regular school meals program, not P-EBT, must be to the maximum extent practicable in a language that families can understand. And following that practice for P-EBT would be extremely helpful, just by providing materials in multiple languages. Minnesota is a great example here. They had their applications available in 5 languages in addition to English. And in our resource library, we do indicate which languages each item was available in. If you're looking for samples in specific languages, you can check there. And next slide, the last lesson that I will cover is to talk about staffing. In the spring and summer, lack of time and funding left states scrambling in a lot of cases to staff P-EBT. But now, with full funding for administrative costs, states have a really great opportunity to staff P-EBT more robustly. There are many possible ways to do that, and I'm not going to talk about it comprehensively, but we did want to highlight 3 areas for consideration as states consider right now how to proceed. The first, as we mentioned, is that troubleshooting took more time than was expected, and it was required for some families regardless of whether benefits were issued directly or based on an application. In some states, backlogs developed that took quite a long time to resolve. So developing a clear process for troubleshooting from the beginning would have reduced frustration for families and school districts, as well as the workload that arose when the same inquiry ended up being addressed multiple times by different people and agencies. So a strong troubleshooting approach would have clear points of entry. It would give families immediate feedback on when to expect a response so they wouldn't keep following up. Consolidate inquiries regardless of how they're submitted. Have clear protocols for how to respond to routine inquiries, and include training staff on how to respond to special but predictable situations. The next area to highlight here is now that cross-agency relationships are in place, states can consider the most sensible role for each agency for this school year and how best to share information across agencies. One thing they might even want to consider is consolidating program management into a single agency or team to reduce the time that they spend sharing information across programs. And then the last point here is that states vary quite a bit with regard to how much they work with community partners, but those partnerships can be very helpful in extending the reach of state staff, particularly with regard to reaching students who are hard to identify or locate, conducting targeted outreach, and communicating key program information to families from a trusted source. So in general, these arrangements were ad hoc over the spring and summer, but states could consider entering into a contract with a community-based group to conduct certain aspects of outreach or troubleshooting going forward. So I am going to turn it over now to Etienne Melcher-Selbin with TRAC to talk about the next lesson.
Great, thanks, Zoe. And now I want to discuss a few more lessons we learned through this project and our efforts this past summer and spring to make P-EBT a reality in every state. So USDA required all states to develop a public information campaign as part of their P-EBT implementation plan, but states' plans varied considerably. As with any new benefit for families, communications is essential to ensuring families are not confused about what the benefit is and the steps they need to take to access it and use it. Of course, doing this rollout in the midst of a pandemic with normal communications channels disrupted made this even more difficult. All the states we interviewed said they plan to be more deliberate in their communications and outreach strategy in the future and want to share some successful strategies we found through our project. So developing a robust communications and outreach strategy that includes many partners, including both the SNAP and Child Nutrition State Agencies, school districts, service providers, and community-based organizations is critical to ensuring students access the program, and these partnerships can also reduce confusion and the number of inquiries to which states must respond. As Alicia mentioned, states took a variety of approaches to inform families and the public. So I just want to highlight some best practices here. So making sure to communicate key messages to the public. Responses to our survey indicated that the most common inquiries from families related to eligibility, benefits going to some but not all school-age children in the household, and benefit status. States can reduce the number of inquiries and reduce confusion for families by providing information about when benefits will be issued, when cards will be mailed, how to activate cards, and what to do if a family does not receive benefits or has difficulty using their cards, and making sure to share it broadly and update this info as needed. It's also important to equip partners with consistent and thorough information, including who to contact on a given issue when troubleshooting. This is especially important for school districts who can be a trusted messenger to families. As Alicia mentioned, Texas was the only state that we know that required school districts to communicate with families about P-EBT, and think that it would be a great strategy moving forward, thinking about, making sure to provide them with information about the benefit, the process, so that they can spread the word through potentially robocalls, text, website, on their website, potentially in multiple languages, flyers, and just to share with families as a trusted partner. In partnership with anti-hunger advocates in many states, such as Colorado, many states developed a P-EBT communications toolkit that included various outreach materials and resources in multiple languages, shared it with interested partners for easy dissemination. Some states also hosted webinars or virtual town halls to share information about the program and to also provide a venue for partners to ask questions to ensure that they were well equipped to help families. It's also important to communicate directly with families. Some successful strategies we saw, making sure to notify SNAP families that P-EBT benefits were going to be issued on their existing EBT card and when. Clarifying to non-SNAP families that P-EBT benefits are distinct from SNAP benefits, and including thorough and clear information in the card mailing so families don't suspect that P-EBT is a scam or throw away a non-marked envelope, and this is especially important in those direct issuance states. Also, it's important to think about and collaborate with partners to reach certain children, such as homeless children and immigrant families. States saw a lot of success in collaborating with service providers and community partners who are known and trusted partners to these families. For example, many states provided tailored information to district homeless liaisons about the program so they could communicate information directly to their students and families. Many states also provided messaging and materials in multiple languages and included language about the fact that P-EBT does not impact public charge in all communications. And just want to flag again, FRAC and the center have a resource library for examples of communications to families and various outreach materials out there, including the toolkit I mentioned and many other states' toolkits. And then I also want to flag, we also saw states have success with reaching newly eligible families. And, and how they saw the success is providing a straightforward way for these newly eligible families to access P-EBT without applying for SNAP. And I think that's something that we states should be thinking about now that we have a little bit more time and thinking through the next phase. And so we have some great examples in the resource library as well as in our report, and so do want to flag that as well. So now I want to discuss another lesson we learned, and that is to simplify card activation. Given how quickly P-EBT was implemented, many states and their EBT vendors did not adapt their SNAP process for families to activate their new P-EBT cards, or update their call center prompts to better accommodate P-EBT customers. This caused a lot of confusion and may have led to families to not complete the activation process. So as we think about the next round, states can take the following steps to simplify this process. Use information other than a social security number for card activation. SNAP's typical approach of using the head of household social security number and date of birth to activate cards does not work well for P-EBT, since P-EBT does not require families to report their social security number to receive benefits. Instead, many states saw success using a student date of birth, zip code, or another number for card activation. It's also important to adapt SNAP call scripts for P-EBT card activation. Some states reported that families were confused about the automated telephone prompts for P-EBT, and by adapting this script, states and EBT vendors can reduce confusion for households and extra work for state staff. And it's also important to let community partners know about the details of the pinning process so that they can help families when they call asking for help. The final lesson we'll discuss is assessing progress. And we saw that states were collaboratively setting goals and assessing progress along the way, and also addressing issues and potentially modifying the program as needed. This is especially important since it is a new program that got up off the ground in just a few months, and so collaboration is key, and really, and especially in those states that do have an application, spreading the word. So we think it's important to monitor applications or card activations. The more local the data, the more useful it is in guiding targeted outreach, technical assistance, and troubleshooting. And of course, making adjustments. Monitoring the data in real time, not just after the fact, can ensure that program administrators adjust plans and operations to address shortcomings. We heard that, in one state, they realized that P-EBT cards had been mailed to incorrect addresses. They developed a simple online form for families to update their address. So that's something that they would have only identified because they were monitoring the data. And then, of course, sharing that data. Sharing data publicly with community partners can help them support state efforts through localized outreach or targeted social media and radio ads. For example, the Massachusetts SNAP State Agency regularly shared zip code and city level data with advocates, schools, and other outreach partners, showing the percentage of P-EBT cards that had been activated. Outreach partners were able to then use that localized data to focus resources in communities with low card activation rates. The Texas SNAP Agency regularly provided application data at the county and zip code level to education and advocacy partners, which used them to target paid radio, television, and social media ads. So it was very helpful in ensuring as many eligible students were able to receive and access this benefit. And so think that data can be extremely useful moving forward. And, I just want to flag that these are just a few of the key lessons we learned over the past few months. And we really look forward to working with states, advocates, and other partners to build off the success of this program. We know that the next phase of P-EBT will look a lot different, as Crystal mentioned, but think that many of the lessons learned over the past few months can inform and strengthen the program as we move forward. So with that, I'm going to open it up to questions. But before I do want to flag that this is just the first webinar in a series that we're planning to do over the next few months on various topics related to P-EBT. And so would welcome your suggestions. Please include them in the chat box on what you'd like to see covered, because we definitely want to be as helpful as possible as we move forward with P-EBT implementation. So with that, I will open it up to questions. And please use the Q&A, not the chat box, to ask questions. Okay. So I see quite a few questions about if the slides will be available. And so, yes, we will be emailing the slides as well as the recording of this presentation to all registrants. So all this will be available. And then links to all these resources are on our website. So we really encourage you to check that out, especially the resource library, because I know that there have been quite a few questions and comments about communications, and there are some really great examples in there. All right, so my first question is for Crystal. We are in a CEP district. We no longer collect applications. Do we need to collect additional information for these families to participate?
Sorry, it took me a minute to unmute. So the great thing about pandemic EBT is that kids who attend community eligibility schools are automatically eligible for pandemic EBT. So if you are in a state that is doing direct issuance, children from community eligibility schools theoretically will be part of that list and should be directly issued benefits. And that's how pretty much all the states did it for community eligibility schools. For states with an application, the families would fill out the application, and then the child's name would be matched against the community eligibility school, and then they would receive the benefit. So yes, if you are certified for free reduced price meals, then you are eligible for P-EBT benefits, but also if you attend a community eligibility school or a Provision 2 or 3 school, then you are eligible for them.
Great. Thank you. The next question's for Alicia. Did you look at states that held student data at the state level versus the district level? Did that have a significant impact on issuance?
Yeah, so we did ask that question on the survey, but the responses we got back weren't reliable because it turns out it's harder to define state level data and student data than we thought, and so definitely something to look into more. We did learn though through like our in-depth case study in Arizona, we learned that they do have a statewide system for child nutrition and store the data at the state level, and that really made implementation in Arizona a little more straightforward.
Great. Since I have you on, I can ask another question. When an application was completed, how did the free or reduced price status get verified?
It depended on how the state set up that system, but that's what the master list ultimately was for in those states. And I could not tell you, it really varied by state how that actually happened, if it was more automated or more manual.
Great, thank you very much. Next question for Zoe, when does the next round begin?
Well, as Crystal mentioned up front, There were some states that, the initial program actually ran through September 30th. So there were some states that did manage to develop plans for August and September benefits and have issued those. For states that didn't do that, the extension allows them to cover the school year and actually through September 30th of 2021. FNS has not yet issued guidance, so I can't speak to what they will say, but our hope is certainly that states that did not issue benefits for August and September will include those months in their plans, and that even states that did, if they had to make simplifications because they thought they were up against a deadline and couldn't reach all kids, will go back and try to reach everybody. And in addition, that any states that still haven't reached everybody for the spring will still continue to work on that.
Great. Thank you, Zoe. There are some great questions rolling in, and want to make sure that we get to all of them that are concerning P-EBT, and we can also, I see some that are state specific, so we can also follow up with you separately. Can P-EBT benefits that were issued prior to September 30th be replaced by the state due to a power outage, due to a storm or fire?
So I believe that when New York asked USDA if they could do replacement benefits, they were told no. So I'm pretty sure that that is the policy, but we can confirm that and get it and share the information with everybody who was on the webinar.
Okay. The next question, did you all look at how many states had dedicated staff to P-EBT and what those staffing numbers were? I think this will be Alicia. Do you want to take this question?
Sure. We did. That was another question we asked on the survey that we realized the question needed improvement because we don't think the answers we received back are reliable. But we do provide what data we gathered in the survey, in the report, if you're interested. We think just states interpreted that question differently in terms of who they included in their numbers. We got much better data from the case study states on that because we were able to engage in a dialogue with them about it.
Great, thank you. I also see a few questions here about August and September benefits for this school year. So as Crystal mentioned earlier, some states were able to issue benefits for August and September, but not all. And I know that's also each plan varies. So I would check in with your state agency about if they are planning to issue benefits for August and September and when. The next question is for Crystal. Can students missed in the spring be issued benefits at a later date, potentially around 200,000 in California?
So our hope is that the USDA guidance that is put out will allow states to go back and provide benefits to children who should have received them but were missed. We have definitely communicated that to USDA. It is how we read the statute, and so that is our hope for the guidance. But until we see what USDA puts pen to paper and says, we can't answer that question yet.
Thanks, Crystal. All right, well, it is, I know that there are a few more outstanding questions in the box, but it is 4 o'clock. So we will wrap up here, but I do want to say for those that do have a state-specific question, I'm happy to follow up with you after this webinar and share information and share the resources that we discussed. But please reach out to us. Here's our contact information if you do have additional follow-up questions on any of the information presented during today's webinar. And as I mentioned before, this is the first in a series of webinars focused on P-EBT, and we'll be sharing more resources and as we move forward, and hopefully be in contact when USDA releases their guidance as well. So thank you again for joining us and for all your efforts on P-EBT over the past few months. As Alicia mentioned, as well as my other colleagues, we know that this was no small task in implementing this new program. And I'm really excited. I see so many that were instrumental in their state in getting the program up and running and making sure that students were able to access the benefits. So thanks to all of you, and we look forward to continuing to work with you to ensure that P-EBT 2.0 is a success. So thank you all, and we'll be in touch, and we'll send, as I mentioned, send an email with the slides, the recording, and all the resources we discussed in a few days. Have a great day, everyone.